Trauma is no doubt a driving factor for many changes in people's lives. And like cancer, its effects spread far beyond what the eyes can see, causing physical, mental, and behavioral damages. And while some are more obvious than others, the hidden effects of trauma are no less severe. Welcome to Brain Explained. In this video, we'll uncover the hidden impacts of trauma and how it shapes our lives in ways we cannot imagine. It's important to understand that everyone responds to trauma differently, and having support in the aftermath of trauma is one of the most important factors in determining the impact trauma will have on a person. This is because a lack of support after trauma is often more damaging than the trauma itself. Did you know that human beings are master adapters? Our biological systems are designed to change in response to whatever life throws at us. Interestingly, research in neuroscience shows that if we witness or experience trauma, our brains can actually take on a different structure. For example, trauma in people with PTSD causes a psychological injury where certain areas of the brain become hyperactive, while others become less active, leading to an imbalance. Check out this video to understand what trauma looks like inside the brain and what physical changes the brain goes through. The common symptoms of trauma are sometimes grouped into 4 types. There's the intrusive memories, also known as flashbacks, the mood changes, avoidance of any reminder or anything that relates to the traumatic experience, and hyperarousal. While these effects can be extremely distressing, there are some equally terrible impacts that you may not even realize are related to trauma, making them more difficult to manage. And the worst part, it can affect your daily life. Believe it or not, trauma can also have many effects on people's relationships with their bodies. In fact, studies have found that a majority of those diagnosed with body dysmorphic disorder have experienced childhood trauma. This trauma now causes them to have a warped perception of their bodies. Interestingly, psychologists theorize it to be a coping mechanism for those with a history of trauma, as focusing on their body pulls them out of past trauma memories. But trauma can also physically affect the body, causing pain and discomfort. This can range from headaches and weakness to a lowered immune system. Trauma is also linked to some long-term health conditions like irritable bowel syndrome, fibromyalgia, and chronic fatigue syndrome. In fact, a study in 1998 focused on people who experienced some adverse childhood experiences, such as witnessing violence, sexual abuse, and neglect at a young age, further proved it. The results of the study showed that those who experience high numbers of adverse childhood experiences were at a higher risk of developing conditions such as heart disease, lung disease, and cancer. The extreme emotional stress caused by trauma has been named the culprit, causing physical changes throughout the body while contributing to structural changes in the brain. Also, neurotransmitters are not left out, as trauma change how they work, especially the stress-regulating hormones. More often than not, unresolved trauma has a profound impact on the ability to communicate effectively. Whether it stems from childhood experiences or more recent events, emotional trauma can leave deep wounds that affect how a person perceives and responds to the world around, creating barriers to effective communication. For example, people with unresolved emotional trauma may be constantly on guard and easily triggered by particular topics, words, or gestures. This makes it difficult for them to have a calm and productive conversation and can cause communication breakdowns. Also, in an attempt to avoid re-experiencing the painful emotions associated with trauma, individuals with unresolved emotional trauma may avoid some particular conversations or topics altogether, leading to communication breakdowns and difficulties in personal and professional relationships. Intense emotions such as anger, anxiety, or fear experienced can interfere with effective communication in those dealing with traumatic experiences. This can then lead to conflicts and misunderstanding. In addition to these effects, emotional trauma can also impact a person's sense of self-worth and identity, leading to feelings of worthlessness, hopelessness, or a loss of purpose. It can also interfere with an individual's ability to trust others, leading to difficulties in forming and maintaining healthy relationships. In general, emotional trauma can have a significant and long-lasting impact on your thoughts, emotions, and behaviors. Without doubts, emotional intelligence is a critical component of communication, and to develop emotional intelligence, it is essential to deal with past emotional trauma. But how can you do this? Well, trauma can be difficult to manage, especially when its effects are not being recognized. Yet there are some great ways to deal with both hidden and obvious symptoms of trauma. Mindfulness and meditation are one of such ways. This is because meditation helps to bring people into the present and help us to reconnect with our bodies by focusing on the breath and other sensations, therefore pulling you out of painful memories. Yoga, on the other hand, connects mindfulness with exercise and can help boost interoception and the mind-body connection of those with a history of trauma. This helps in fostering a greater sense of safety and re-regulate the nervous system. And because trauma does not follow a typical manifestation pattern, treatment is usually a big challenge. This is why professional help is needed. Overall, targeting the root causes is highly essential in resolving the impacts of trauma, allowing you to move forward and live a full, happy life. If you enjoyed this video, give it a thumbs up. Don't forget to subscribe. Thanks for watching.